What's up, you guys? Austin Marks here. Today I'm going to be talking about what a respiratory therapist is, what we do, the schooling, different certifications that we can get, and where a respiratory therapist can work. So I'm going to start off by reading a quote from the ARC website, just explaining what a respiratory therapist is a little bit. Respiratory therapists are specialists and educators in many areas including cardiology, pulmonology, and sleep therapy. Respiratory therapists are clinicians trained in advanced airway management, establishing and maintaining the airway during trauma and intensive care. Respiratory therapists initiate and manage life support for people in the ICU and ER, as well as on transportations throughout the hospital or from one facility to the next. Respiratory therapists can also work in outpatient clinics. I'm going to talk about them a little bit later. Let's talk about the schooling now. So typically, a respiratory therapist program is anywhere from 2 to 4 years. I personally went to a community college and I got my associate's degree, and now I'm having my hospital pay for my bachelor's degree. In my opinion, this was just a smart idea rather than going to a 4-year school and then paying $40,000 up front. I paid half the price and now I'm working while I'm still getting my bachelor's degree, and we're all going to have the same education in the end. So different certifications that a respiratory therapist can have include they can either be a certified or registered pulmonary function technologist. I'll explain what that test is a little bit later. They can be an adult critical care specialist. They can be a neonatal/pediatric specialist. They can be an ECMO specialist. They can be an asthma educator. And I'm sure there are much more certifications that they can get. However, these are just a few that I named. So now I'm going to talk a little bit more about what a respiratory therapist actually does in a hospital. So we go ahead and we assess our patients to see if they have any lung issues or their breathing problems. We'll go ahead, we'll run by their medications, what medications they're taking, and if they should be taking more medications, we'll go ahead and we'll run that by the doctor, and then we can make recommendations that we think the patient should be taking, or if the patient should not be taking a certain drug because it's not needed. The doctors usually say, yeah, it's a good idea, we'll go ahead and we'll do that, or sometimes they'll just say, no way, my way is better, which is totally understandable. Respiratory therapists are also the ones who analyze sputum and arterial blood gases. We're usually the people who get them, and then we can either run it at bedside or we can send it off to a lab to get read. Respiratory therapists also work in the intensive care unit, also known as the ICU. What we do in there is we mainly run the ventilators, which is also known as life support. When a person is having issues with their lung or any breathing issues at all, what we'll do is the doctors will put a tube in, which is called intubation. Typically we assist with that, and then we'll go ahead and we control every aspect of the lungs after that until they're completely healed, or healed enough to manage without that machine. We respond to every emergency situation in the hospital, including rapid responses, code blues, and then if your hospital has a trauma bay, we respond to them as well. Typically at a code blue, a respiratory therapist is at the head of the bed. If we're putting in an airway intubation, as I said before, we go ahead and anesthesiologists or the doctors will do that, and then as soon as the airway's in, they hand it to us and we take control from there. Or we can manually give the patient breaths, and then we also will educate our patients basically on tobacco cessation, about quitting smoking, their medications, if they have asthma, if they have cystic fibrosis, different things they can do, what they can't do. We just talk to them a little bit, help them understand their diseases. Now, some outpatient clinic things that respiratory therapists can do is they will run pulmonary function tests, which is where patients will come in, they'll blow in a tube or they'll suck in, and then this basically analyzes the amount of airflow that's allowed in the lungs or that's being restricted. It can also measure something known as the arterial capillary membrane, which basically says if oxygen is actually transferring over to the body or if we're just breathing in all this air and nothing's actually happening. Um, Respiratory therapists can also be in pulmonary rehab clinics. So patients who have COPD or other respiratory problems will come in. They'll get their vitals checked. They'll run through some exercises, and they'll basically just the respiratory therapist will get the patient more comfortable with everyday activities. That way, they don't feel as short of breath or anything like that. Um, Other things that respiratory therapists do, as I mentioned earlier, is they work in transport. So I know some respiratory therapists will run babies that are born at one hospital and transfer them to another hospital where they have a level 1 NICU or something. The baby needs a little bit more needs a little bit more care, anything like that. We also transfer just regular adult patients from one hospital to the other all the time. So, where can I get employed as a respiratory therapist? Well, of course, they work in the hospital. You can work at different clinics. You can work in a laboratory. You can work in a sleep clinic. You can work for a medical equipment company. You can work for a long-term acute care facility. So this is basically when someone has an airway for the rest of their life. They're on that ventilator, and they can't really go without it. So therefore, sometimes family members will care for them, or they'll go to this place, and then respiratory therapists, nurses, CNAs, doctors, they'll look after them there and just keep them company and make sure that they're in good health. You can also be a teacher as a respiratory therapist. That's how we go to school, of course. Or you can work through a nursing home. So as I said, my name is Austin Marks. Just explaining a little bit what a respiratory therapist is. If you have any more questions, go ahead and leave them in the comments. If you'd like me to talk about anything else, maybe a little bit more about the schooling, the hours I work, things like that, go ahead and just leave a comment.